Cancer is one of the major causes of death around the world. Though people are now familiar with cancer as a disease, awareness in terms of prevention and treatment is yet to reach the masses. Dr. Jonas Stumpf is a senior consultant radiation oncologist and advisor on oncology and cyberknife services at Apollo Specialty Cancer Hospital. When people are first diagnosed with cancer, obviously they are shocked. How do you help them handle the report and counsel them regarding the treatment?
Well, that's a fantastic question. Let me give the credit to you because this is one of the most important part of the medical service or the service of the oncologist towards the patients. It is true that a fresh case will always enter the consultation room with lots of stress on the face, and it is obvious that they are fearing for the life, they are fearing for the type of treatment they have to face and cope with, and they're fearing the financial consequences of the treatment as well. So it's a very, very complex. Plus, in the less educated part of the population, unfortunately, cancer is something which is considered as a shame, which is absolutely wrong. Cancer is not a contagious disease. And apart from a small segment of the cancer, you can't do anything for it or against it. Nevertheless, the fear of the patient has to be handled, tackled, and resolved by the oncologist. And this is one of the most difficult parts of the job, even after 40 years on that particular field. I find this is the most challenging thing. Patient enters the consultation room, we exchange a few words, a couple of minutes will lapse, and in this short period of time, the doctor has to see what is the way the stress can be resolved of this particular human being, not a patient, that human being. So it stresses upon the complex character of the medical service, number one, and also that everyone, an oncologist, has to think about how to handle, how to cope, and how to help the patients with the fear. I am very happy if the patient leaves the consultation room with a smile on the face, but not every patient has to be brought to that situation on the same way. There's a very, very complex issue, and it's something where the human character of the medical doctor makes a big, big difference. Empathy, for instance.
How is life altered after a cancer diagnosis? What are the challenges a person with cancer has to face?
There are physical, there are mental, there are social, and there are financial challenges. The physical, it is something where the doctors will explain, and the doctors have to adjust the treatment according to the tolerance of the patients, both physically and mentally. That is again not a very easy job. But otherwise, beyond the physical, the social change, in India, it is relatively, comparatively much better versus the western part of the world. India is the country, a marvelous country, where the people are artists of intercommunication or different social networks, etc. So the backup of the patient is much better than the West and the so-called developed world. Nevertheless, the patient do need that kind of support, and of course they need the financial support as well, because cancer treatment is not an easy job. It is not very inexpensive. It can be rather very expensive as well, though it is a very important issue to be on a balanced way. What is the real need of that particular patient, and how can it be matched best and the most economic way?
Can you tell us some of the treatments available for cancer? How accessible are they?
Basically, the treatment of cancer is standing on three legs: surgical oncology, radiation oncology, and medical oncology. Medical oncology treats the patient with medicines. The surgeon will cut out the disease, and the radiation will be focused at the diseased or likely diseased part of the patient's body. I think since cancer, its character is a chronic disease, even the people on the rural India can access a reasonable cancer care. Here in Chennai itself, we are having other cancer institute, we are having government sector, and we have a private sector. And all are on a very, very reasonable level or even top level. So theoretically, even a person in rural India can have the appropriate treatment. CMC Vellore is also there. Number of different institutions, any other part of the country. I don't say sufficient, but they are there. If at a magic hint or hit, every cancer patient would come for treatment, certainly the treatment would not be accessible. So again, a kind of balanced development is needed. Awareness so that the people do think and do come, and at the same time increase both the quality and the quantity of the complex cancer treating facilities. The issue is that mass majority of the patients are diagnosed with a cancer by the surgeons. The baseline of the diagnosis, even today, is biopsy and histopathology. Obviously, it is taken by a surgeon. But once, if the diagnosis of cancer has been established, it is very important that every single patient has the opportunity and the interest also to consult an oncologist, preferably not an alone standing, but an oncologist who works in a team, who works in a cancer hospital, where every day they are giving treatment, complex treatment to all the patients. That is the goal of the day, and that is how the cancer can be reasonably efficiently managed today.
When does treatment for cancer become a recurring one?
Whenever a cancer patient is successfully treated, that means that the cancer was eradicated. There is a risk that even it will come back from the non-visible small seedlings, either around the primary site or somewhere in the body. Therefore, the patients are requested to come for regular follow-up. That is number one. Number two, the first 2 years is the most critical part of the follow-up. Even a cancer under control, likely to come back if he wants to come back within the 2 years. But as a general, in the majority of the cancer cases, let me say in 75–80%, after 5 years of cancer-free interval, we call the patients free of cancer, cured. Not all the type of cancers, but for the majority of them, this is the so-called rule or general understanding. So once if the cancer comes back, then we need to find out how it can be controlled after the first line treatment with the second line treatment, what kind of combination has to be provided and advised. It is always individual. Let me be very clear, there can be guidelines, but the guidelines have to be applied on the individual patients with a fantastic judgment of the service provider, the medical person. The guideline knows how to treat the patient, how to treat cancer, but not how to treat the actual patient in front of the doctor. The guidelines is the same for a 16-year-old and an 86-year-old, with obvious consequences.
What must a person do to get the best benefit from a treatment? in terms of lifestyle and habits?
It is absolutely understandable that there is a kind of self-blaming. Oh, I got cancer. Of course, it is a punishment of God, of punishment of nature, of whoever is believing in what. And now I got it. So how can I change my lifestyle to have a better escape? In principle, a normal, balanced lifestyle does not need to be changed. If the lifestyle, however, involves chewing tobacco, then the lifestyle has to be changed and the chewing tobacco has to be stopped. That is very clear. Or any other kind of non-social or asocial habits which can promote cancer. But in general, I am not strongly advocating for any kind of lifestyle treatment. Ask the doctor. No need for changing your normal diet for a diet of carrots or carrot juice or pomegranate or Tibetan medicine or homeopathy or whatever it is. It is always the oncologist who has to tell, fine, this is an adjustment treatment. You can add it to your normal treatment and then you will benefit. The same with the change of the lifestyle.
Is cancer preventable?
That's a very complex question. In general, in principle, I don't think so. Cancer is built in and coded in our genes, and like the human body is getting aged, similarly, the likelihood or the risk of cancer will increase. That is something what nobody can change. But there are certain type of cancers which are preventable. For instance, the cancer of the uterine cervix. Recently, Dr. Zurhausen in Germany has received the Nobel Prize for his invention and research, saying that the virus infection with human papillomavirus plays enormous role in the development of cancer of the uterine cervix. So, preventing the infection, awareness about the infection, and also checking whether human papillomavirus is already there has a role. But as a cancer prevention, I would rather stress about the preventing the cancer to be detected at a late uncurable stage. That is cancer screening. Unfortunately, there is no way how we can have a general cancer screening. There is no test. You can give all the 6 liters of blood you want to the lab. You have to the lab. They will not be able to say whether in general you are a cancer patient or not. But there are certain things and there are certain cancers that are preventable, especially the female cancers. The cancer of the uterine cervix can be detected early by pap smear, can be to a certain extent prevented by the cure of the human papillomavirus infection. The breast cancer can be detected early by regular cancer screening. The oral and all the head and neck cancers can be properly screened and with simple clinical examination. So these are the things what has to be known to the individuals, to the lay public, and have to be taught of. And the other thing is that cancer is not necessarily a deadly disease. It can be cured today.